Laying back and looking at the stars sounds pretty relaxing for anyone, but especially for those patients in hospice care. Dr. Ruth Thompson is the Chief Medical Officer at Hospice of Dayton. She joins us this morning with more about laser star therapy. Dr. Thompson, thank you so much. First of all, to you and all of your employees and volunteers, too. Thank you very much. You truly are saints for the work that you do. Tell us about laser star therapy. It sounds like something from a science fiction movie, but actually it really does work, and it's really a great idea.
It is a good idea. Actually, one of our nurses developed the idea after she identified that some of our patients continue to experience anxiety and restlessness and agitation despite what we could do with medications and other therapies. And she reflected on her own past experiences and thought about the night sky and came up with the idea of the laser light therapy.
And this is kind of a scenario where the patient would be preferably relaxing and just kind of looking at those stars that we just saw, all kinds of images from the sky, and that's one of your employees there caring for him.
Yes, absolutely. That's our nurse who actually developed the idea and who was currently conducting research at our hospice house in Dayton.
That's kind of what it looks like there, and it's basically you're using projectors, right?
Correct. We're using projectors called a stargazer, and it projects the laser light onto the ceiling and the surrounding walls, so it's obviously best used in a very darkened room. And it also uses the application of color because color is very important. It uses green and blue. You know, green is typically associated with nature and safety, whereas blue is generally associated with peace and tranquility. And they've actually found that those colors can cause our bodies to produce calming chemicals that potentially help this work.
It's amazing because light therapy, it's not just like you're looking at something cool. Light therapy has been proven to reduce stress and anxiety, which is what a lot of your patients have, unfortunately.
Yes, it has.
What is the reaction so far? Have you talked to people that have...
We have. We've actually been applying the therapy since 2001, or I'm sorry, 2011, and so we've been able to, interview the patients. Some of the patients can describe their reactions to it, and many of them will reflect upon a good memory from their past. And we not only look at their reactions and what they describe and the nurse's subjective reaction to whether they physically become calmer, but we also look at objective data such as heart rate, respiratory rate, blood pressure, and we've actually been able to show that in most patients those levels will come down. So if their heart rate is very elevated, it will come down. Same thing for respiratory rate. So there is definitely seems to be some science behind it.
What a great idea, and what great work you do to make anything easier for the people in this unfortunate situation. So that's a great idea. For more on laser star therapy and Hospice of Dayton, just go to our website, fox45now.com, and click on Fox 45 in the morning. Dr. Thompson, thanks so much.
Thank you so much, Mike.
Keep up the good work.
Appreciate it.